Contracting has its benefits and it has its disadvantages.
Because quite often that first knee-jerk reaction is if we don't provide the service, people will not vote for us.
Nous avons un système éclaté, nous avons un système à plusieurs vitesses.
NGOs don't have a signboard that says the Ministry of Health and Social Welfare. They have a signboard with their name on it.
Nous participons un petit peu à la fragmentation du secteur éducatif parce qu'il y a beaucoup d'ONG avec des visions et des financements différents, travaillant dans différentes zones du pays.
We can't stop delivering services. And the way of doing it, maybe getting through NGOs, would help improve access.
Dans 10 ans, ces enfants d'aujourd'hui, c'est une Haïti bien triste qui nous attend parce qu'ils n'auront rien reçu, ils sont sous les tentes, ils ne vont plus à l'école et personne ne les prend en charge.
We are only here temporarily. They'll ultimately have to take over responsibility for the healthcare service delivery, and they should see us as a partner, not an implementer.
Contracting out really is a decision that can be made by a government looking at a particular service that it wishes to supply or to which the citizens of that country want to be given to them, whether that service should be something that they deliver themselves or whether it's something that can be effectively delivered by providing a third party with a contract to deliver that on behalf of the government to its citizens.
For many years in Haiti, you had a very particular situation where many of the services you normally associate with the state, especially social services, are performed by others, either by non-governmental organizations or by private sector individuals.
On a coutume d'utiliser des organisations, soit des ONG, soit des firmes, pour exécuter. Donc des fois c'est des choix du ministère, normalement assumés, et des fois, c'est un peu les conditionnalités des projets qu'on met en œuvre.
In Liberia, we have two types of contracts that we are doing at the Ministry of Health. One is contracts that are awarded by donors to people to do things for us. And the other contract that we are doing is a contract that we do ourselves with money that donors have put into our pool fund.
Why there is such a large representation of civil society, NGOs and private sector in the social sector here is because the government hasn't had the capacity. And I don't think until recently the international community has had the confidence in government to run services and therefore have tended to go around the government at times to reach directly to other organizations to fund them.
Traditionally in Haiti there has been a limited capacity and a lack of resources to be able to ensure 100% coverage of public schooling. So a lot of the services from primary, secondary, vocational, early learning have been contracted out to non-public entities.
Nous avons signé un contrat, ils nous donnent des notes, le tableau que vous voyez ici, les matériels scolaires, même les cahiers. En fait, nous pouvons dire sans Save the Children, l'école ne pourrait pas fonctionner cette année.
Ce n'est pas tant le ministère qui a fait appel à ses fournisseurs de services, c'est plutôt les besoins de la population. Il faut les satisfaire. Pour parler en termes économiques, il y a un marché. Et donc, étant donné que le ministère n'a pas cette capacité de production, le ministère est bien obligé de faire appel à ce genre de service.
Nous travaillons pour l'État haïtien parce que c'est le devoir de l'État haïtien pour faire fonctionner l'école. Mais à cause de peut-être pas manque de moyens, mais c'est à nous, nous sommes les citoyens du pays, nous devons participer à cette œuvre qu'est l'éducation.
Nous offrons un service au nom de l'État parce que c'est le travail de l'État. Et puisque en Haïti même nous avons une constitution et la constitution déclare clairement que surtout pour ces élèves-là, et en matière de la section primaire, ils devront être sous la responsabilité de l'État. C'est sûr que nous aidons l'État.
In conflict countries, the health system is broken down because there is destruction of infrastructures. Health workers ran away, some died, others go out of the country. And when there was restructuring the system, there was very insufficient health workers.
It was essentially a question of capacity in terms of service delivery and management. The government recognizes, and I think it's not always easy to say we recognize that we will continue to need external assistance for a couple of years for implementing, for service delivery purposes. And I think that recognition is already something very important.
The benefit for us is that it gets you to do the work quicker because it brings in expertise that you do not have. It brings in people who are experienced in doing the projects and the monitoring and taking care of your logistics. So when the contract is awarded, you get the results and you get it quick. So that part of the contract is good.
We can't stop delivering services. And the way of doing it, maybe getting through NGOs, would help improve access. And the fact that we improve access of essential interventions would definitely help, would definitely contribute to the reduction of these high maternal mortality rates, high under 5 mortality rates of today.
It's very much a decision of government. Ideally, I think it should be in consultation with the stakeholders that are going to be the recipients of that service or that function if they're going to be affected, balancing up the various pros and cons of the benefits and costs associated with that particular decision, but it is one that they should make. You need that sort of quality control, and that's where the government comes into place, where it can work with those service deliverers, work with those communities.
In the Liberian context, it was very beneficial and positive because the health sector had good leadership, and right from the beginning they were able to establish mechanism of negotiation.
The idea of contracting out by the Ministry of Health actually makes the ministry to own the process in a sense, because in the past the NGOs have been implementing and not answerable to the ministry, even if the money was given by a donor on behalf of the ministry.
In 2008, JSI did an assessment, and then a report that came was very favorable, that indeed Liberia has the capacity, the ministry has the capacity to contract our NGOs. Following that, we worked with our partners to develop the contracting policy, which gave the legal language to contract out.
The decision with regard to what facility has to be constructed and with regard to what facility has to be rehabilitated is gently discussed with the Ministry of Health based on the priority list.
So the reports now are not going to the donors, but they're coming to the ministry, and the ministry is looking at the reports and seeing that, you know, this is what we are hoping for, this is what we want, this is not what we want, and we are actually making the decisions on what they should be reporting.
En Haïti, nous travaillons avec le gouvernement. Nous avons développé un protocole d'accord avec le ministère de l'Éducation nationale et de la formation professionnelle. Dans ce protocole d'accord, nous exposons toutes les activités, le paquet de services que nous voulons donner aux écoles, la liste des écoles. Nous avons environ 300 écoles dans lesquelles nous intervenons.
Là, il y a une structure de passation de marché. Et quand il y a un accord avec un gouvernement, c'est les procédures de l'État qui sont en général appliquées.
La personne qui nous donne les fonds, c'est la personne à qui nous rendons les comptes. Secondairement, nous rendons les comptes aux partenaires locaux, c'est-à-dire la structure locale avec qui nous travaillons. Si nous travaillons avec une organisation communautaire, nous rendons les comptes à l'organisation communautaire, mais nous ne rendons pas compte directement au gouvernement.
The performance-based contract between Malin and the Ministry of Health is very clear with regard to the deliverables. If you're not on track, the ministry would definitely give recommendations on how and how we can reach those targets. And we'll also have to provide explanations on why we are not meeting the targets that have been set in the contract between the Ministry of Health and Malin.
It's performance-based, so we use a carrots and sticks diplomacy. So when you perform well, you get a bonus. When you don't do well, you get spanked for that, so you don't get bonus. So it pushes people out to rather go above and beyond.
Contracting has its benefits and it has its disadvantages. The people that you have in your country want to see the government doing things. Now you come and tell the government, we are giving you the money to do the things, but we cannot give you the money. We will contract people to do it. The government is not the one seen as the person that is doing it. We have that situation here. The World Bank gives money to the government, but the Chinese are contracted to do the roads in Monrovia City. Then they will say, oh, that's the Chinese doing it. They will not see it as the government that is doing it. So we have a situation in this country where we have given contract to NGOs to do things for us, but the NGOs don't have a signboard that says the Ministry of Health and Social Welfare. They have a signboard with their name on it.
Il n'y a pas vraiment de renforcement de capacité de l'État à vraiment fournir les services.
What we found again was this huge provision of services, often without any kind of standards or quality control.
Qui établit la politique institutionnelle de l'éducation en Haïti, c'est clair et net que c'est le ministère de l'Éducation nationale. Mais si votre question était est-ce que cette politique est suivie, je vous dirais là c'est une autre chose parce que Haïti on fait ce qu'on veut et tout le monde fait ce qu'il veut. Les inspections sont très rares et pas de qualité. Donc chacun impose sa manière de faire et son choix de méthode et d'application.
The international community has decided that its past practice of avoiding government involvement has to end and that we all now have to support the government to start to take control of its own country.
I think for now, it's going to continue. The idea is all this, when they're doing contracting out, there is always a plan of phasing out of the NGOs. So there is a question of capacity building of the county teams and the district teams to be able to take this over.
There may be a problem of how to hand over. The transition may be not smooth. If you did not plan properly and see how we're going to do smooth handover to the government or to a new partner will be taking care of your health services.
We will continue to do contracting, but we have to refine it to make sure that people understand who is paying who for what and who gets the credit.
In terms of the government being in a position to implement all education services directly, it's really too early to say at this stage. We've come from a situation where the Ministry of Education was directly controlling 20% of schools in Haiti, the other 80% being covered by non-public sector organizations.
Step one is to help the government set the policy framework, standards, guidelines, develop the capacity to monitor what is happening. Second step for the government to implement and monitor these standards, to provide standards for training so that, for example, whether it's pharmacists or whether it's teachers, they are following one national curriculum in schools, one national drug policy, that their training is of a standard where you can expect the quality of services to be provided to be good.
For now, the idea is capacity. Once the capacity is there, I'm sure the government will take the initiative of phasing out the NGOs.
To train medical doctors takes several years, but we know the challenge.
It needs at least 20 years for a country which is recovering from conflict to be able to take over responsibility over development, not only in health but also in agriculture, in transport and infrastructure and so on.
C'est en réalisant ces exercices que le ministère va se renforcer et il faut que cette occasion soit donnée au ministère pour se renforcer, pour exécuter, même pour tâtonner.
Further down the line, the government would like to start taking back the delivery of services in healthcare, in education, but that's going to be further down the line. Step one is the basic frame within which providers must act.
On a besoin de l'aide, mais c'est l'État qui doit avoir d'abord un programme d'éducation.